If winter leaves you feeling isolated and low, you're not alone. Let's explore how to beat seasonal affective disorder. Winter is coming and chances are that you are feeling down. You're tired all the time, you're craving carbs and you feel isolated. But there could be more going on than just a winter blues. You could be affected by seasonal affective disorder, or SAD for short. But in this video, I'll show you what it is and how you can effectively beat it. Hey, my name is Sun. I'm a 5th year medical student and I'm somebody who loves diving into science and mental health. And that is why I'm going to share some key insights about seasonal affective disorder, or SAD for short. This is a disorder that affects millions of people each and every year. And stay tuned till the end because I'll show you some clinically proven effective ways to beat SAD. Seasonal affective disorder, or SAD for short, is a form of depression that comes and goes with the seasons. It mostly hits the hardest during the winter months. Although the mechanism of it is actually not that clear, scientists believe that it's because of the lack of sunlight during the winter months. Less sunlight means less serotonin and thus makes you feel down. But it also increases your melatonin levels, which makes you feel sleepy all the time. But SAD is more than just feeling a little off. It is a serious condition. In some countries, 1 in 20 people gets affected, especially in countries where there is less sunlight, like Alaska for instance. The symptoms of SAD go beyond just feeling a little off. You might feel deep fatigue, even after a few nights of deep and good sleep. You might also be craving carbs or sweets, which just means that you will be eating more and thus gain weight, which doesn't help with the problem. Social interactions like meeting up with friends can also feel exhausting, which can lead in just you not meeting up with your friends anymore. And depression can make it hard to actually climb out of your bed each and every day. This is more than just a winter slump. This is an actual condition that needs attention. Some risk factors include living in places with long winters and minimal sunlight. Other things like having a darker skin tone or already having a history with depression or anxiety, and for unclear reasons also women have more chances of developing SAD. Luckily for us, there is a lot that we can do to prevent and treat this condition. And in my opinion, the most important step is to actually recognize that you feel this way. The sooner that you recognize the symptoms of SAD and that you get the treatment you need, the better the outcomes. Early diagnosis and treatment can significantly better your quality of life during the winter months. Before we dive into the treatments of SAD, I would like you to like and subscribe on this video. This will spread awareness to more people so many more can learn about SAD and how to cope with it. So, for the treatments. The first and the best thing you have to do is go outside, even if there are cloudy days. Because there is a lack of sun, you have to go out even more. But indeed, it is probably winter and the sun is not out that much. So the second best thing you can do is light therapy. This is with specialized light boxes, which you have to use for 30 to 45 minutes each and every day. But there is a catch. You'll have to find a certified light box, and that means they have to be at least 10,000 lux and have a UV filter built in. My advice is that you consult a specialist and ask them for a light box that fits you. You could also consider the supplementation of vitamin D, because 42% of the US population and even more in Europe are actually vitamin D deficient. If you want to know if you also have a shortage of vitamin D, I suggest you go to your general practitioner. Things like salmon, eggs or mushrooms could actually help level up your vitamin D. Also, other supplements could help. But I must say, first get your levels checked by a general practitioner, because vitamin D is actually a fat-soluble vitamin, which means you can actually overdose on it, and that could actually lead to death. Next, cognitive behavior therapy. That is another very powerful tool. It can help you change your negative thought patterns and behaviors that contribute to SAD. A therapist can really teach you techniques that will help you manage your seasonal depression. And if none of these methods work, please consider more professional help, because at this point it is not likely that you'll get through this alone. It is important that you talk about how you feel, but also your friends, family must not be left behind. Contact your friends that you haven't heard from in a while, or people that looked a bit sad when you last saw them. If we would all collectively do that, most of the mental issues would be picked up sooner, and these people would get the treatment that they deserve at the right time. If you like this video, you probably also like seeing a day in my life. This is my first week in med school. Watch it next.